Hello and welcome to the State Psychiatric Hospital Network COVID Corner Town Hall. My name is Jay Chaudhary. I'm the Director of the Division of Mental Health and Addiction. And I'm here with FSSA Secretary, Dr. Dan Rusyniak, and Chief Medical Officer, Dr. Signe Finnel. We are thankful for you all for watching this webinar. And the purpose of this is to answer questions about the medicine and science surrounding COVID-19. We've received a lot of questions in advance, and many of those questions were about the CMS vaccine mandate. So just at the outset, I want to make clear that, that mandate as of yesterday has actually been put on hold nationwide by a court, issuing a nationwide injunction stopping that mandate from being enforced. That's still in a lot of legal uncertainty and limbo, and so we don't know where that will land or where that will end up. So today we're just going to focus on the medicine and science surrounding COVID-19. As a state, we have not yet made a decision, and really can't make a decision about how to handle the mandate because we don't know where it's going to end up. So I'll go ahead and let Drs. Rusyniak and Finnel introduce themselves. But before I do, I want to make sure to thank all of you, each and every one of you, for your service during an unprecedented time, a really difficult time. I've had the honor of visiting each of the hospital locations during the pandemic, and have consistently just been blown away by your service and your dedication, and just how much you care about Hoosiers with serious mental illness. So just thank you. And then Dr. Rusyniak.
Yeah, so and I will echo my thanks to all of you for the work that you've done. I did want to give just a little bit of my background, and Dr. Finnel will do the same, just so that you understand that although as a secretary, I also have some expertise in this particular area. So by training, I'm an emergency medicine physician, and I still work one day a week in the Eskenazi Emergency Department, and have done so before, during, and up to now through the pandemic. And so in that role, have seen lots of individuals with COVID-19, have talked to a lot of individuals and families about complications from the infection as well as the vaccine. In addition, I'm a medical toxicologist. This is a unique medical specialty focused on particularly poisonings and adverse drug reactions. And so in that capacity as well, and in my previous background, have a lot of expertise around how certain medications can cause adverse effects, including medications like vaccines. So in that, I'm going to turn over to Dr. Finnel for her introduction.
Thank you. Hi, everybody. I'm Signe Finnel. I'm the Chief Medical Officer for Family and Social Services Administration. My background is that I'm a pediatrician. I'm also a health services researcher. Clinically, in the past, I worked in infectious disease at Riley Hospital. And at this point, I still serve at Riley Hospital one day a week and see patients, and weekly have conversations about COVID and COVID vaccines with the families we serve, the patients sometimes, but often the parents.
So we'll kind of break up, I think, some of these questions, kind of certainly those that are around pediatrics. We're going to look over to Dr. Finnel to answer to answer those. Also would just mention that in both of our roles throughout the pandemic, we have worked closely with and at times over at the Department of Health, and also still really keep up to date on the latest information. And I think we'll talk today a little bit about Omicron, since that is even since the time I think that we initially envisioned and scheduled this, that is something that's come to the forefront. So we'll try to answer some questions around that. So I think we'll kick it over to you, Jay, to kind of go through the questions that have come in already.
Great, thank you, Dan. And I'm not a doctor, so I will not be answering any medical questions. So we've collected questions before this date, but we also have somebody monitoring the chat function. And so if you have a question or want to ask a clarifying question or follow up, feel free to put that in the chat. We'll make sure that gets asked. All right, so we're going to dive right in here. So question number one. There's been a lot of push to get everyone vaccinated, but now we're hearing that vaccinated people are also getting COVID-19. If that's true, then why should I get vaccinated?
Yeah, I think that's a pretty common question that we heard. So initially, that I think all of us heard the push towards getting vaccinated, and then when Delta came out, there were some folks who were getting what we would call reinfected or reinfection. And so if that's true, what's the value of getting the vaccine at all if people are potentially going to be at risk of still getting infected? So I think it's important to clarify, first and foremost, the overall goal of the vaccine in any vaccine campaign is to decrease serious illness and death. And that's first and foremost. And really, from the very beginning of this, that was the thing that we had the most fear of when COVID first came out in Indiana, at least in March of 2020, is how would this impact Hoosiers, particularly how sick and how many individuals would require hospitalizations and die. And the vaccines have been incredibly effective at preventing severe illness and disease. And so first and foremost, that is the primary reason an individual would want the vaccine for themselves. In addition, a vaccine does decrease, because it decreases severity of illness, it also decreases the spread of COVID-19. So it also becomes an incredibly important tool to protect those around you. And that includes your family, your friends, people you interact with, and the patients that you take care of in the hospital. So decreases severe illness and decreases the spread. Now, reinfections do occur. And the reason they occur is that immunity is not typically forever. And so if you get a vaccine, and say you get the 2 shots of a Moderna or the Pfizer vaccine, you're going to develop antibodies. And antibodies are, the way I think about it, are like the little police force or army that is in your bloodstream looking for any COVID virus. And if it sees it, quickly attaching to it and destroying it. But that army over time will eventually decrease in numbers. And so we know that over time, antibody levels start to decrease. Now, when that happens, we can see occasionally folks can get a reinfection who were vaccinated, but even those individuals, because the system still has memory and they can produce soldiers again really, really quickly, those reinfections tend to be far less severe. So we know from the data a little bit that somewhere in that 6-month time frame for Pfizer, and particularly as you get older, that your immunity will start to wane. And so it wasn't surprising, I think, once we had that data to see that somewhere in that 6 to 8 to 10 month time frame after individuals get vaccinated, occasionally, if they were exposed, they could get an infection again. But again, one of the benefits is having had that previous vaccine allows your immune system to very quickly produce the army again that's needed. And so people typically get far less symptoms. And if they were previously vaccinated and get reinfected, they carry the virus for a much shorter period of time, which also means that they are less likely to spread it. So I think, to reiterate, getting a vaccine decreases severe illness and death. And even if a year, 6 months, 8 months from now, you had a reinfection, it also decreases the severity of illness that you're likely to have.
Okay, thank you. Second question. I've heard that you get better immunity if you get COVID-19 compared to the vaccine. If I have had COVID-19, why do I need to get vaccinated?
Yeah, I think this is a good question. And I do think I don't say there's misinformation. I think that I don't think we've done a good enough job of acknowledging that individuals who get COVID-19 and recover have some immunity. We know that. And even in the beginning of COVID-19, the CDC acknowledged that as well by saying that at least for 90 days that they would be considered immune. So anytime you get an infection and you get ill and then get better, the reason you got better is you developed an immune response to it. And that immune response will last. Now, one of the difficulties with what we would call natural immunity versus the vaccine is we have a lot of information on how long the vaccine immunity lasts. And again, we can see people start to lose immunity somewhere at that 6 to 8 month time frame after the vaccine. We don't have as much good information as to how long immunity lasts for individuals who just got COVID-19 and recovered. We know some individuals can get a reinfection as early as 90 days. And so that's why initially the CDC was stuck on 90 days as how long they considered people immune after a natural infection, because they started to see some breakthrough cases in individuals who had COVID as early as 90 days. But some individuals are going to have immunity much longer than that, 6 months or even longer. The problem is we don't know, and you don't know individually where you're going to be. Are you somebody who's going to have really good, a really robust immune response that's going to last for 6 months, a year, or are you somebody who's going to have an immune response that only lasts for 3 months? So that's been one of the difficulties of just relying on natural immunity. And also you see this even in individuals who have had COVID-19. People respond differently. So some people get really, really sick with COVID-19, get horrible fevers, maybe get pneumonia, end up in the hospital. Some individuals get the sniffles and seem to do fine. So individuals respond differently because they also have different immune responses. And you can't look at your particular response and think, I have a great immune system because I either didn't get sick or, well, I was really sick, so now I must have immunity. It doesn't seem to work exactly that way. One of the things that's not controversial, I think, is that if you did have COVID-19 and then get a subsequent vaccine, your immune response is better. It's better than if you just had COVID-19, and it will last longer. And that is, to some extent, what we see when we required individuals to get the second shot and then the booster shot, is that the first exposure created immune response, but the second exposure to the vaccine and now the booster really increases that immune response. So if an individual wants to have and wants to essentially guarantee that they have the maximum immune response and the maximum protection, it makes intuitive sense, even if you've had COVID, that you would go on and subsequently get the vaccine. There's a little bit of data out there and science out there, it's not fully fleshed out yet, that would suggest that individuals who had COVID-19, who then got the vaccine, actually get incredibly good immune response and actually may even develop some immune response against other versions and other forms of coronaviruses. So again, that data is still preliminary, and so we don't want to rely on it necessarily, but it's another way of saying the evidence to date suggests that if you had COVID, you're still better off to go ahead and get a subsequent vaccine.
Thank you. This question is for Dr. Finnel. There's been a lot of chatter about the COVID-19 vaccine and fertility. Will the vaccine affect the ability to have children in the future?
Thank you so much for that question. Great question. I've heard it a lot also from my own teenage children, actually. So COVID-19 vaccination and boosters, I just want to clarify, are recommended for people who are pregnant and people who are trying to get pregnant now, and also people to think they want to get pregnant at some point in the near future. So that is the absolute recommendation, and it's important to know that. It's also important to know that there is no current evidence that COVID-19 vaccine or any other vaccine for that matter affects fertility. We don't have a history of vaccine having that effect. We do have a history of infections affecting fertility, but not from vaccines. So that's important to know. So you may still be hesitant and wonder about this. So what evidence do we have today then? Well, they have actually done studies on this. We have now been in this pandemic, unfortunately, for more than a year and a half. So they have had time to look at this. So they have looked at women who are wanting to get pregnant, who have had no history of infection or vaccination. And then they have looked at women who have had the vaccine. And then they have looked at women who have had the COVID infection. And then they've looked at sort of their success rate of getting pregnant. And it doesn't differ between the groups. So for women, they've continued to follow that, but that's certainly evidence that we don't think that the vaccine affects the fertility. For men, they have looked as detailed as actually looking at sperm counts and looked at men who has had the vaccination versus those who have not, and they have not seen any difference at all in the male fertility either.
Great, thank you. This question is also for Dr. Finnel. So this person is pregnant and concerned the vaccine could harm their unborn baby, but they're also concerned about getting COVID-19 while pregnant. Do we know which is worse? And then for people who are having babies, is it safe to bring them home if we work outside of the home? So kind of two questions.
Great questions again, and very important for people. So I think this has been hard for people to sort of digest, because in the beginning, we didn't know a lot about the vaccine. So there was very unclear recommendations for pregnant, essentially, women and whether they should get the vaccine or not. Now we know that the infection is far worse for pregnant women. They are at risk of more severe COVID-19 infection than women that are not pregnant. They're also at risk because of that COVID infection. They're at risk at giving birth to a baby too early. And being born early is often bad for babies. Some do well, but a lot of babies don't do well when they're coming too early. So it's definitely far outweighs the benefit of the vaccine, or the small side effect risk of vaccine is sort of far less than the risk of getting a COVID-19 vaccine infection if you're pregnant. I think we also know now that if a mom is giving birth and has had the vaccine and then are breastfeeding their baby, there's actually some degree of antibodies from that vaccine that's passed over to the baby that then provides some protection for the baby. Exactly to sort of what degree that is and how well the baby is protected, we are still learning, but that's definitely the way it looks. So good for both pregnant moms and babies for women to get vaccinated.
Yeah, and I would add to that, when pregnancy itself is often a risk for having severe illness from a variety of different infections, and COVID has been no exception. Unfortunately, it's still fairly rare, but at the hospitals that I work at in Methodist and Eskenazi, there have been several moms who ended up on ECMO, and ECMO is complete life support. You actually have to support all their breathing and even sometimes their heart function during that pregnancy, and had to have those babies delivered. And even though the moms often were not unable to survive. So pregnancy is a risk because it does depress your immune system. And so getting that vaccine really does confer an extra bit of protection for the mom. And in almost every study, no matter what we're looking at, the safest way to help the baby is to protect the mom. And so if mom is protected, baby tends to be protected. And I think even coming home, it's another good reason to surround an individual who can't get a vaccine with individuals who do and can get the vaccine. And so if you've got a newborn, they're going to have some of those antibodies pass on. But if you're worried, and we should all be worried about the unvaccinated in the middle of a pandemic, making sure that the family around that child are fully vaccinated really is the strongest and the best way to confer safety to that child.
And I also want to add, this also holds true for the boosters for pregnant women, with actually being pregnant is a great reason for getting the booster if it's time for you to do that. So.
Thank you.
Yeah.
This question's shifting gears a bit, talking about testing. Start with Dan and Maria if you want to chime in. What are the different tests you can get to detect COVID-19? And what is the difference between the PCR tests and the tests people can do from home?
Oh yeah, so different tests. So there are really two main tests. We'll touch, really there's three. We'll touch briefly after I talk about the first on the antibody tests. They're not generally recommended. But there's two main ways that we test to determine whether somebody has COVID-19. That is what we call a PCR test, and the other is what we call an antigen test. Now, a PCR test, and this is the one typically that you get through one of the clinics and one of the drive-throughs. Sometimes people feel like it's the swab that goes all the way back into your brain, right? So the way that test works is they collect a little bit of liquid either from your nose or back in the far back of your posterior pharynx. And what they're testing for is even just really teeny bits of the virus RNA. Now, because the amount of RNA they pick up is so teeny, they have to send that off to a lab, and a lab does a special test called a PCR test to make that little strand of RNA replicate enough to where it's detected. And so the reason I say that is that you'll know if the PCR test, because typically it's way back. And B is it takes usually a day or longer because it has to go to a specialized lab. Now, the good thing about that test is it's really good at detecting the virus, even if the virus is no longer active, and even if the virus is in really small quantities in your nose and your posterior pharynx. And so it's a great test, and we don't get a lot of what we would call false positives with that test. Typically, if it's positive, it means that you had COVID-19 at some point. And there's less false negatives, which means that it's less likely to come back negative if you have COVID. They still have some false negatives, but not as often. So that test is kind of, it's not perfect. It has problems, but it would kind of be considered the best test at determining whether you have or had COVID-19. Now, one of the problems with that test is because it can detect such little bits of the virus, is you can detect people and people will test positive with that test even for months after they've had COVID-19, recovered, and are no longer infectious, because you can carry little bits of and little remnants of the virus in your nose. So it's a great test, but once it's positive, there's really not a lot of value in redoing that test for a period of time, because again, you can stay positive long after you're no longer infectious. Now, so the downside to that test is way back, has to go to an outside lab, and it depends on how many people are getting tested that day, can take anywhere from 24 to 3 or 4 days to get the results back. The other test is an antigen test, and this is the one that sometimes you'll see as a test result in 15 minutes. There's a couple different versions. The BioNX now, which is an Abbott lab test, is pretty common. You can actually buy them in Walgreens and CVS stores and do them at home. Now, those tests work by looking for a protein that's on the surface of the virus, because proteins are bigger and in larger amounts. They don't need to go to a special lab. And you can, that swab is typically just in the anterior part of your nose, still not delightful, but nowhere near as people don't feel it's as bad. And it takes about 15 minutes. Now, the good thing about that test is if you have symptoms and you test positive, it's pretty good at detecting that, because you've got a lot of virus in your nose. The problem with that test is it's not as sensitive as the PCR test. And so it misses some people, even people who have COVID-19. And so if it's negative and you have symptoms, you can't rely on it. So if you get that test, that 15-minute test, and it's positive, and you've got a runny nose, or you've got a cough or fever and body aches, you have COVID-19. But if you have those symptoms and it's negative, it's still by itself probably not reliable enough. So the recommendations are still going to be that you go out then and you get the PCR test. So the benefit of it is it's fast, and you can get information now that might prevent you from, for instance, going out into the workplace or visiting your family. If it's positive, you'll know then you can protect your family a little bit faster by quarantining yourself in your house. But it does miss a fair number of folks who have COVID-19. So
Great. I said I wasn't going to chime in, but I do have one sort of thing to say.
I was going to talk about an antibody test too, real quick.
Oh, go ahead.
Yeah. So the one other test that you can see is the antibody test. And this is a test where they draw blood. That's how you know it's an antibody test. And they'll still tell you and test you whether or not you have antibodies against COVID-19. Now, first of all, if you got a vaccine, it's probably going to be positive because you have antibodies. If you've had COVID-19, you may or may not, depending on the test that they use. The problem with that, it's not as reliable. And that test has a pretty bad track record of both having false positives and false negatives. And so most folks generally don't rely on that as a way of saying I'm immune because I had this test and it showed I had antibodies. And most people wouldn't really rely on it for saying it said I don't, and therefore I need to go get another vaccine again. So in general, we tend to leave those tests more to surveillance and monitoring into the research labs that are trying to track this. They'll do different tests than the quick ones that you might get in like your pharmacy, and you'll get a 15-minute antibody. So go ahead with your question. Oh, go ahead.
Well, I was going to say, but this is where it gets so hard to be the sort of consumer, right?
Yeah.
Because we, for a while in this pandemic, talked about the antibody test as the solution to sort of figure out who had COVID and who had not. And that has completely changed. So at this point, that test, it doesn't lean.
Yeah, I wouldn't do them personally for anyone. I wouldn't recommend it.
Yeah, I think a common concept through all this, vaccines, testing, masks, all these things, is the concept of mitigation. I think it's been unclear and sort of not talked about in an accurate way. So I think that oftentimes we talk about things in absolutes, like, will this stop me from getting COVID? Will this stop me from transmitting COVID? Will this detect COVID? And the answer is almost never for all of those 100%, right? Especially if you look at it on an individual level. But all of those things, whether it's, testing at a gathering or testing at a work site, even if it's the 15-minute PCR test or getting vaccinated or wearing masks, all are mitigation tactics. And so mitigation means lessening the risk of. And I think that a lot of times we have not done anybody any favors by talking in terms of absolutes. So I think that a common thread to all this, again, is the idea of mitigation. So
yeah, 100%. And that you'll see that the curves in terms of populations of COVID cases going up and down, and people tend to look at that and say, oh, COVID's, none of this has worked. Well, it has worked. Really what you don't see is how big the curve and how big the peak would have been if we hadn't had in these mitigation factors. So it's like, driving at 55, right? It doesn't guarantee that you can't be in an accident. It just reduces the likelihood that you would be.
Yeah. But it can also be kind of painful.
Oh, yeah. Driving, you mean driving 55?
Driving at 55. Especially if traffic's going.
I know when I ride my seatbelt in James. Okay.
So going back to Dr. Finnel here, question about the vaccine for children. So children don't really get sick from COVID-19, do they? And if that's the case, then should they get the vaccine?
Great question. It is true that children sort of, as a group, get less sick from COVID-19 infections than adults do, and certainly even more so than elderly adults. That does not mean that children are not affected by this pandemic at all. They can get COVID-19 infection, and it can be pretty bad, often more like flu-like symptoms, but we have actually lost the approximate of a school class in Indiana of children to COVID-19. So it does happen, much less than the adult and our seniors that we have lost, but it does happen. But in addition to that, there's a few other things that children can get from COVID-19. One is it's called multi-inflammatory syndrome in children. That is sort of an interesting process. It happens in children who have been either had COVID, and they may have had such mild COVID that they didn't even know they had COVID, or the parents didn't know they had COVID. But then in the time frame after that, they develop this severe inflammation of important organs in their body. Specifically, sometimes the heart is affected. And when children get this MIS-C, as it's sort of called, they actually often need intensive care and end up hospitalized. They often do well, with lots of support and treatment. And we have had hundreds of children in Indiana hospitalized for that. There's also an additional thing that you may have heard sort of about in the adult population from COVID, that some people have lingering symptoms, so they have just symptoms that last. We call it long COVID, and we see that in children as well. I personally have had a friend of my daughter who was affected by that, and they certainly, that means that a child is affected for a long time, taking them out of their normal activities and what they're normally doing. So while children, yes, as a group, are less affected by COVID than adults, they're not affected.
Yeah, the other thing I would add to that in the vaccine is that it also provides an extra bit of protection depending on where you are in your school systems on not having to potentially send that child home when they're exposed. And so I know every school system sort of probably operate a little bit different, but having that immunity may also protect them from having to go home potentially if they're exposed into their school environment. And as a parent of 3 children, and I think the same. Like I want my kid in school for a reason, for socialization and for all those other things. So anything that I could do to decrease the probability that my kid would have to go home for 14 or 10 days, which is a pretty long period of time. And now with testing, I think sometimes we can shorten that to a week, but it's still a pretty long period of time for a kid. Anything I can do to reduce that, I would, as a parent, want to.
And I want to add a little bit more about the vaccine for children. So at this point in time, vaccine for children are approved from age 5. And there is a difference in regards to the vaccine from sort of age 5 to 11 versus older children. And that is that the dose is less for younger children. And they have tested and shown that children sort of get the same immunity from that lower dose than older children gets from the higher dose. So that has been carefully tested.
Anecdotally, and you tell me as a pediatrician, I do think that they've had less severe symptoms after getting the vaccine. Like the kids I know who are in that range really seem to do just fine. Where I do know a couple adults who are like, man, I felt really wiped for a day, or I had a really bad headache for a day. I don't know if it's because they have a lower dose, because they're kids and they don't complain, but
anecdotally, it seems to be the way. But there are some still children that get sort of tired and so forth from the vaccine, but seem like they're less affected than adults getting the vaccine.
Kids do complain.
Oh.
And my kids get their second dose here in a few days, so I'll let you know what happens there. So this next question concerns variants. Originally, it was just about the Delta variant. However, as Dr. Dan alluded to, since the time of this scheduling and the time of the recording, there's been a new variant pop up. So Dan, can you
Yeah.
explain, a couple things, the difference between the Delta variant and the original strain? How do we know if someone has Delta? And then what's the deal with Omicron?
Yeah, good questions across the board. And I may phone a friend here as well. So if you think about what viruses do, like viruses make copies of themselves. That's how they spread. And they are not as efficient at making copies as, say, your copy machine. So the great thing about your copy machine is every page is going to look fairly similar. When viruses make copies of themselves, they often make little mistakes. Now, sometimes those little mistakes mean that next virus can't replicate and it disappears or it dies. But occasionally through randomness, it'll make a mistake in itself that allows it to spread faster or to create more severe illness. So those are what we call variants. And all viruses that we sort of think of typically have variants that arise. So the flu virus is an influenza virus, and it's pretty bad at making copies of itself because it tends to mutate pretty quickly, and there's lots of variants of it. So the shot you get this year, right, might protect you this year, but by the time next year comes around and that virus has now gone down to Australia and it's worked its way around the world, it comes back as an almost totally different virus. And you need to get a new shot almost every year that's slightly different from last year and based on what they think. So viruses are really like their inherent nature of them is for them to create variants of themselves. So first and foremost, with coronavirus, and we know this about other coronaviruses, this was an anticipated problem that we knew we were going to run into, is that the virus would make mistakes and some of those mistakes would change it. So that's how they get into what a variant is. It's a mistake or a change in the virus, and then it's a change in the virus that confers some benefit to the virus, either by making it spread faster or occasionally by making it what we call more virulent or cause more severe disease. Now, we had this alpha variant that was the original COVID-19 that we saw, and then there was other ones, but the one that really got our attention was Delta, and that's because Delta, more so than the alpha variant, was so good at spreading. It was much better at spreading to other people, and it probably, the data suggests, probably caused folks to have a little bit more severe disease. And we really went from alpha variant to the point where when we were measuring, the only thing we were seeing is Delta variant. And we can talk about how we measure these different variants in just a minute. Now, all of a sudden, what we're seeing is a new variant called Omicron. And that actually was initially detected in a variety of countries. But I think it's important to note, where it's detected does not necessarily mean it's where it's originated. It just means the first folks who did the detailed analysis that identified it. So it was identified in a variety of countries near South Africa, really just about 2 weeks ago. It was really just before Thanksgiving. And the reason it got everyone's attention is that when they sequenced it and they looked at it, it didn't just have a couple mutations or a couple changes to the virus, it had a whole bunch of them, a lot of them. And they noticed that it was spreading pretty quickly. So it seemed to, based on their initial experience, spread pretty easily. And that always makes virologists and immunologists and infectious disease folks concerned. It can spread fast. But when they looked at it, it looked so much different from the Delta and the Alpha variant that they became concerned. Is this different enough that our immune systems, if you had a previous infection or if you got vaccinated, will no longer recognize it? The same thing that we worry about every year with the flu. And so those are the initial concerns now with Omicron. It seems to spread pretty quickly, and it's pretty different in terms of the number of mutations it has. Now, the short answer is we don't have the answers to all these things, and that's going to take, and we think, probably a week or 2 weeks for us to figure out. And the things that we'll really want to know is, does it spread more than Delta? We know it spreads it seems to spread at least as much as Delta, but maybe it spreads more. It has some of the same mutations. And then what we also don't know is, does it make people sicker? So I think it's important to mention this. Some viruses mutate that make themselves spread easier, but also make people less sick. And so not every mutation makes somebody sicker. And it's pretty common for viruses over time to mutate in a way that they're less what we call virulent, or they make people less sick, because then they're easier to spread. Generally, if somebody dies, they can't keep spreading that virus to somebody else. So we don't know the answer as to whether it's going to cause more severe illness or less severe illness, but we are collecting that information around the world. One of the benefits of COVID-19 across the board is we are doing surveillance in ways that we never did before. And that's because it's one thing to say I'm positive for COVID. It's another thing to take that sample and actually do the whole kind of RNA and DNA sequence of the virus and say, like, how different is this virus by looking at all the different nucleotides compared to the last one. And now we do that around the world. We do what we call sequencing around the world for viruses. So we detect these variants very quickly, and because of that, also we can respond very quickly. And so if this turns out to be a virus that we worry about more so than we are right now, because it tends to spread and cause people to be illness, the good thing is the companies that make the vaccines are already preparing to how they might respond. The other thing to mention with this virus is it still has to outcompete the current virus, which is Delta. And so that's one of the things that if we don't know if it's in an area where there's lots of Delta infection, will it have an advantage over Delta so that suddenly everything will be Omicron? That's what we saw with Delta. So we had Alpha, Delta was introduced, and we saw a little bit of both, and then it just became Delta. So there are variants that pop up that we measure that they just don't compete as well against the previous variant, and then they disappear. So we don't know that yet with this. So
I also think it's worthwhile to point out that this does not mean that we're back to square one at all. We know tons now. The reason we know about Omicron is because we know so much about COVID virus, and we are carefully going to see how this virus or this particular variant, if vaccines are affected or treatments and so forth and so on. But it doesn't mean that we're not going to be back to square one at all. I think that's important. Like, not a reason for not getting vaccinated, for example. Yeah. In fact, a reason to get vaccinated.
Yeah, absolutely. And a question that comes up sometimes is, are the vaccines causing the variants? And the answer is no. If anything, vaccines really do prevent the variants. So variants occur when the virus can continue to replicate for a long period of time. And so two ways that we'll see variants happen is that more people get infected, and then the probability that somebody who gets infected has that mutation that makes it more infectious is one. Or interestingly, one individual gets infected who has decreased immunity or decreased immune response. So maybe they're on cancer agents, or they have poorly treated HIV, or they're on immunosuppressants. And that virus the body never gets rid of it. And so it keeps it in low levels, but it's able to keep reproducing over and over and over in a single individual. Those are typically the two ways that we see variants produce. But vaccines do not cause them. What vaccines actually do is, by decreasing the spread of it, dramatically decrease the probability of it. And that's probably one of the big reasons why we see these new variants coming out of places like Africa and some of the other places where we first are detecting them. It's because the vaccine rates, because they haven't had as much access to vaccines, are typically lower. Another great reason and another push that if we could get large percentage of the population vaccinated, not only would we be protecting ourselves against this current virus, but we'd be doing an amazingly important thing to protect ourselves from variants and future viruses.
So it's fair to say that every time a virus replicates, there's a chance of a mutation, because there's less virus replication when people are vaccinated, there's less chances of mutation.
Yeah, and I will add one last thing, because I forgot, unless we said it already, is that the immunologists and the virologists and the CDC, they do still think that your current vaccines will likely have some effect at decreasing severe illness and death from this new variant. People might get the infection, but we still have this belief that it will likely decrease severe illness from it.
Great. Okay. So I'm going to move on to another question. I think it's related to Omicron, in the sense that I think one of the biggest things we've seen with this new variant is maybe irresponsible media coverage and reporting. I think that, part of, this has been a pandemic of a virus, of course, but it's also been, I'd say, a pandemic of misinformation. And this question is about that, right? And so, Maria, this question is sort of for you, but we all chime in on it. what are some unbiased, peer-reviewed information sources that we can get specifically regarding vaccines for children?
Thank you for that question. Really important. There's been an enormous amount of information about COVID-19 from all sorts of sources. It's really difficult as a parent, as a patient, as just a member of society to sort of figure out where to look. There are a few places that provide really good local information, but also sort of nationwide here in the US, good information. So one place I would highly recommend is to look at Department of Health website about COVID-19 in Indiana. We have been praised in Indiana for how well we sort of actually report out how many infections we see, how if people end up in the hospital or not, how many get the vaccines in different age groups, and as well as, of course, sadly, the people that die. So Department of Health website is really useful. That also has it actually has sort of a question and answer section as well, with lots of very common everyday questions about the vaccine or about the disease. So that's a great place to look for us Hoosiers. In addition to that, although some people sort of gotten some bad press, but the CDC website is a national source of really good information in the US. It is based on data and science and not opinions. And it's a good place to sort of get a sense for what's going on in the US. It also has good question and answer section.
Yeah, I go to both as well. And I know that people have sort of, and you're right, I think in the way it's been portrayed in the media and on social media, we sort of are picking sides right now. One of the things that's hard for folks is that science is an evolving process. Science is never, like you said, black and white. Like in the beginning of the pandemic, we didn't know a lot. We know more now. We're going to know more next month and next week. And so what recommendations come out will naturally change over time as we learn new information. But we do tend to sort of put people into camps of whether I believe this or I don't believe this. But I agree. I think the CDC not only has good information, they tend to present it in a way that I think is fairly understandable. I would also encourage you that if you've got a physician that you see, your pediatrician, your family doctor, who is a trusted source for you, that is always a personal relationship that you've had with that individual. There's no physician I know of that hasn't been immersed in this, particularly if they're internal medicine, family doctor, OBGYN, pediatrics. So we've all become COVID experts by necessity over the last year and a half. So also consider reaching out to them and talking with them about it if you've got specific questions or you're hearing information where you think that doesn't sound right. Be wary, I think, of information passed on by friends, even though I hear them a lot in family. Unless you know specifically what the details are, because again, we tend to not always get all of the story when people pass it on. We tend to hear little bits of it. We may not have all the details and all the information around a case. I will say anecdotally, like I've been working in the emergency department for a year and a half through the pandemic, and I've taken care of hundreds, if not thousands, of individuals with COVID-19. And I know when the vaccines came out and there was all this concern about adverse reactions and all the problems with vaccine, I will tell you, and without bias, I have yet to take care of a single individual in the emergency department with a vaccine related problem. That I'm not saying they don't occur, they do occur, but I have taken care of hundreds, if not thousands of individuals with severe COVID-19. So my experience in looking at that, I'm like, well, the vaccines are I think incredibly safe, incredibly effective, because the people I take care of are mostly unvaccinated. But if that one person who has a problem with a vaccine, like if that story is shared, it's hard unless you know the whole story, right? It's hard to like, where is that risk really put at? So, and how do you compare those two things? And that is why it's really incredibly difficult, I think, for people to navigate this just massive information. So again, CDC, local health department, or I think you're a trusted physician are the best places to go and have those conversations.
And I would sort of, to Jay's point, this is where media has not helped us either, because they have sometimes the rare things, the very rare things becomes the big front news or the news coverage in the TV and so forth. And that's it. Unfortunately, it has become like that.
And the two things that give me the most confidence are number one, just the sheer amount of vaccines that have been delivered in across the entire world. We're
200
talking
over 200 million in the
over
US.
200 million in the US alone, well above that across the entire world. And then number two is the absolute transparency. People often talk about the vaccine reporting system as some sort of like, hidden secret source of repository, but it's literally a public facing website that people voluntarily report to and is, sponsored and relied on by all of the institutional sources. And so I think that, it's really important to remember that we are doing this, number one, in real time, but we are getting good, robust data, and I think people are being as transparent as possible.
Yeah, no vaccine has been studied more. No disease, I think, probably has been studied more right now than this one. So
great. Question from Maria about masks, and that kind of really ties into some of the other themes we're talking about. This is about why do the mask recommendations keep on changing?
So again, really difficult, right? When the recommendations are changing over time for all of us to sort of keep up. But I think this actually speaks to what you talked about mitigation strategies. So before vaccines, we didn't have that much, right? We had a few tools in our toolbox. One was masks to sort of cover up both the coughing out the virus, but also maybe breathing in the virus. We also had the social distancing, sort of staying apart, further apart, spending time outdoors turned out to be much better than spending time indoors and so forth. So the mask was just one tool in that toolbox of what we could do. And then the vaccines came along. But again, this is not black and white or everything or 100% or 0%. The vaccines changed a lot for us. We were able to do so much more and had much more protection with the vaccines, and we still do. But when something is very contagious, that some of those new variants were, so the Delta first, and then maybe now we don't know about Omicron, but it's one more tool for us to sort of add. So maybe we do need the vaccine, and in certain environments, maybe we need the vaccine and the mask.
Yeah, and I would add to that, when we had the Alpha variant, when you were vaccinated, that seemed to be the only tool that you needed. Once it became Delta, and it increased the amount of virus in people's nose and mouth by like 1,000-fold, like once Delta came and became the dominant strain, then it wasn't enough to just be vaccinated to decrease the spread. So. And
around people who are very, very vulnerable, maybe immune suppressed, maybe that's going to be the vaccine and the mask for good protection.
Any questions coming in that we want to address? Okay, keep going.
Another question about booster shots. Are they the same as your first two shots? Can you mix and match? How soon should you get them?
Yep. So boosters are, again, to go back to reiterate, when you get your initial vaccine series, you're going to get an antibody response, you're going to get immunity, and then over time, that's going to eventually decrease to the point where you might be at risk for at least getting the virus again. Fortunately, not getting severely ill again, but getting the virus again. And that's where, when the science came in and we started to see that wane or see that decrease, we said, well, people need a boost. And so giving them an additional shot then suddenly takes those antibodies and that immunity and kicks it right back up to where it was right after they got that first series. And so that's why the boosters came about. And so then the question on is, how are they the same and how are they different? We've got 3 different vaccines. So for the Pfizer vaccine, the booster is really the same dose that you get in your first 2. So it's like getting your 3rd dose of Pfizer. And it's generally recommended for everyone now who is eligible for the vaccine at least 6 months after the first one. And again, that's after the second shot, after the first series. Thank you. Good correction. After the first series of vaccine. So you've had shot 1, shot 2, and then 6 months later or more, you should consider getting your booster. Now, Moderna is similar in that they recommend you get that booster shot at least 6 months after that second shot. But keep in mind, the Moderna vaccine had a much higher amount of what we call mRNA in it than the Pfizer did. And so when they were looking at boosters, they realized that they didn't need to have the exact amount they had it. And so they lowered it. I think it's about half. So the booster shot for Moderna is a little bit lower of the mRNA dose than the first shot, but causes that same increased response. And then the Johnson & Johnson vaccine, that is a little bit different, right? So the Johnson & Johnson vaccine, a different type of vaccine. It relies on what's called an adenovirus vector, and the other ones are mRNA. So it's slightly different type. And it was initially is a one-shot vaccine, which was great, but the immunity from that doesn't last quite as long. And so we started to see more people getting reinfections from Johnson & Johnson earlier than compared to the others. And so the recommendation on the booster there is if you're 2 months past your first shot to get it. Now, if you have a Johnson & Johnson and the question comes up is, should I go get a Moderna or a Pfizer? And the short answer is it probably doesn't matter. Right? If you had Johnson & Johnson and you want to get Johnson & Johnson again, because you're like, I had the shot, I know how it affected my body, I don't have to worry about anything else, totally fine. The response is really good. But if you want to mix and match it, the CDC says that's totally okay as well. So you could get a Pfizer, you could get a Moderna. There's a little bit of data that suggests going from Johnson & Johnson, Moderna, Pfizer might confer even a teeny bit more immunity, but we're talking really fairly small amounts. And so I would tell individuals to weigh, like, if you are worried about a different type of vaccine and you want to stick with one you had, then just get the Johnson & Johnson again. If you'd like to maybe increase it by a little bit and you want to have an mRNA vaccine, then you could absolutely get Pfizer or Moderna. If you had Pfizer or Moderna and you're like, should I switch? I wouldn't switch into Johnson & Johnson. I think most people have generally recommended it. Be fine, I think. But if you had Pfizer, do you want to go to Moderna? You can. I don't know that it matters quite as much, but you can. And the real benefit of that is not even so much now, but in a year from now or 3 years, if this becomes, and we don't know yet, but if it becomes a regular vaccine that you get, then it may not. We don't want to have to track 5 years ago, was I Pfizer and now I'm getting my yearly shot. Is it Moderna? You'll just be able to get whichever one you want.
I also think it's important to point out that needing sort of a series of shots is not unique for COVID-19. That's actually pretty common for several vaccines. So as much as this has been debated a lot, it is not that.
Yeah, I mean, hepatitis, MMR.
Yeah, we do several vaccines this way.
Shingles,
Very
a lot
common.
of them.
Very common.
Yeah,
So,
flu's pretty uncommon that it's a single shot. So.
And it's not for young children.
Oh, it's two shots. There you go. See, that's why you have it.
One other question that I think we hear a lot, I think it's a very understandable question, and I think the answer to it, frankly, just a spoiler alert, is we don't know are long-term effects of vaccines. Obviously, the only way to really get certainty on that is time.
Yep.
But do you want to speak about long-term effects of vaccines in general? Maybe.
Sure. I start.
You start.
Yeah. So that is correct. Like, you never know anything with 100% certainty until it occurs. But what we do know is the history of all the vaccines that we have administered to people, including everyone who's had to have a vaccine for school or for work or depending where you work throughout, the last 50 years or so. We have all of that information. And what we do know is that vaccines, like any medication, some people have an adverse response to them. We know that sometimes people with the mRNA vaccines rarely can develop allergic responses. Same with the Johnson & Johnson. There's a really rare risk, but it's real. It's a really rare risk of developing a special type of blood clots with the Johnson & Johnson in women who are under the age of 50. So we know that adverse reactions can occur. But what we do know about them is they occur usually within the first week or two after the vaccine. So in all the history of all the vaccines we've given, we know that even the worst effects, we think about Guillain-Barré that was associated with swine flu and occasionally associated with all these vaccines. We know that all of those really bad effects, typically, if they're going to occur, and they occur rarely, I will reiterate that, but if they occur, they tend to occur in the first 2 weeks. We really don't see a history in vaccines that we give here in the United States that somewhere down the road, having had this vaccine, you develop a problem. So if there was a long-term problem from this vaccine, it would be the first one really in our recent recollection that we have seen developing down the road. It doesn't change your DNA. It doesn't do that. It doesn't change anything in your body. The way vaccines work is they introduce a viral protein to your immune system that then recognizes it. I think of it like the Army, like it's the wanted poster for your immune system. If I ever see this again, I'm going to attack it. And that's the way all vaccines for the most part work. They all work by introducing typically a viral protein, whether that's done through an mRNA or through an adenovirus or through just the protein itself. There's different ways we have vaccines, but they all tend to do the same thing. And so our experience with vaccines in summary is that if they cause effects, they tend to do so fairly quickly and not long-term down the road.
And I sometimes wonder if this name, the mRNA vaccine, has made it people sort of unfortunately making the connection to DNA. These vaccines or these two vaccines are not
Yeah.
changing a person's DNA. Very important to
Yeah,
say.
they do not.
All right. Well, I think that's all the time we have for today. Thank you, everybody, for your questions and your attention. Thank you, Dr. Dan and Dr. Maria, for your time
You
today.
give me Dr. Marina. That's
Yeah.
the best.
And as always, open door to any of us, for any of you, for any question. And thank you.
Yeah, and again, thank you all for what you're doing in the hospitals every day, throughout and today in this pandemic. Continue to do the work. You are truly healthcare heroes. I don't think we can say that enough for all of the folks out there that are working in healthcare. So thank you again for all that you're doing.
Thank you.